Thanks very much for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. Tonight, more South African students head back to school, even as the country sees the number of COVID-19 cases it's tackling climb. Worried parents fear that it's too soon to restart classes. Also, Burundi's new government brings in new and tougher coronavirus policies. The late President Pierre Nkurunziza had declared that divine protection would be enough. His successor, though, has launched a new national screening drive. And in Ivory Coast, the economic slowdown caused by COVID-19 suspected of having plunged around 7 million people into poverty. The government's financial aid program is proving insufficient support for many of the most vulnerable. But first, thousands of South African students have headed back to class in the second phase of the reopening of schools, even as the country struggles with reining in a surge in COVID-19 cases. Pupils in grades 6 and 11 have picked up their studies again. Those returning have had to show permission slips from their parents, but many remain worried that the move has come too soon.
Scary. It's really a scary feeling because I'm still working from home, and to bring my daughter back to school, and she's also scared, nervous and all that with all the regulations and stuff,
This pandemic that we're in now is very, very deadly and very serious. So as a parent to stay with my kids at home without her getting an education, it's a problem. Also bringing her to school, it's also a problem because I don't think they will practice that social distance as a school, even though the teachers and the staff can tell them to do the social distance, but they themselves, children are children.
Well, last week, the government won a legal challenge that had called for schools to remain shut because of the continued risks of coronavirus. On Monday evening, the country confirmed 197,000 cases with almost 3,200 deaths. South Africa has more than 40% of the continent's coronavirus infections. MC Ferreira tells me more about how many parents were ready to send their kids back to class on Monday.
Various provinces and regions are still doing the math in terms of today's attendance. I spoke to the Western Cape Provincial Education Department. They were expecting almost 250,000 students to come back to school today. But they simply don't know at this point because it's been complicated also by the fact that parents can sign exemption forms. If their children suffer from comorbidities, conditions, or if they're simply too anxious to send them back to school, they can sign these forms. But these were only sent out on Friday, so they simply don't know which number they're going to get back yet. And also those forms say very clearly that if you take this option, you're fully responsible for homeschooling your child. And this places parents in a very difficult situation because, of course, they've been homeschooling their children for 3.5 months since the hard lockdown began here. And many parents themselves have had to go back to work when that ended on the 1st of June. So they're caught in a very difficult situation.
So the country has seen a spike in cases. What is the government's plan in dealing with that? Is another hard lockdown on the cards at all?
Again, we simply don't know. We fully expect that when the latest figures are released tonight by the Minister of Health, that the country will pass the 200,000 mark in terms of infections. There's a fatality rate of just under 2%. And of course, that's almost double the ideal figure at the point at which a country would normally reopen its economy. Here, they had no choice but to do that a month ago because the country is in a recession. We've had calls from the Premier of Gauteng, who's now faced with a big surge in COVID infections in his province, saying he would like to speak to Cabinet and ask them to bring back stricter lockdown restrictions in that province. But we simply don't know because there's also been contradictory statements from other ministers of his administration. So that's a political choice we expect to play out in the coming weeks.
And where in the country is seeing the highest numbers of continued new confirmed cases coming out?
Well, the Western Cape, which was the epicenter of the outbreak here for several months, still has the highest number of infections. We've got 70,000 infections here. But Gauteng is rapidly catching up, and we think about to overtake the Western province because it now has an increase of several thousand new cases a day. It's very much concentrated around Johannesburg, and particularly the southern parts of the city, the poorer areas like Soweto. So that means that Gauteng now has the highest number of active cases because out of the Western Cape's infections, 50,000 of those patients have recovered.
It looks like Burundi's new government is changing tack on its coronavirus policies. For the first time, a major national screening drive has been launched. President Evariste Ndayishimiye is ramping up precautions against the spread of the disease. He took over after his predecessor, Pierre Nkurunziza, died last month. Officially of a heart attack, but diplomatic sources have reportedly said that there's a high probability he may have died of COVID-19. Nicolas Chemin has more.
It's a serious U-turn. For weeks, Burundi downplayed the dangers of the coronavirus. Former President Pierre Nkurunziza had said God was protecting the country. But then he died suddenly last month, and many Burundians believe he could have had COVID-19. His successor, Evariste Ndayishimiye, is taking the virus much more seriously. On Monday, the government launched a vast testing program.
Nous avons été agréablement surpris par la réponse de la population parce que nous avions tablé sur 250 personnes par jour au niveau des 3 communes, mais à 14 heures, vous avez constaté que nous avons déjà prélevé plus de 419 échantillons.
Many Bujumbura residents came for coronavirus screenings.
kubera iyi ndwara yateye ntinarinje kwipimisha hama mu ndabire yuko noba nkomeye
je nje kwipimisha ngo ndabe yuko nkomeye nta n'inkorora ndwara nta n'ibicurane nta n'iki nje kwisuzumisha nove ko mu mubiri ari libre.
Officially, there are fewer than 200 cases and only 1 death, but some doctors believe the real figure is higher. The government said it would subsidize soap and the tests are free. Critics say this U-turn has only occurred because the World Bank donated $5 million last month for the fight against COVID-19.
Look now at some news in brief. South Sudan and Burundi could be kicked out of the East African community after the bloc's assembly passed a resolution to remove their membership because they haven't paid their fees. A final decision will be taken when the heads of member nations next meet. Burundi owes around $15 million, South Sudan about $27.8 million. Out of the 6 members of the EAC, Kenya is the only one to have fully paid its $8 million annual membership. Uganda, Rwanda and Tanzania are also in arrears. At least 13 nurses have been arrested in Zimbabwe for protesting in Harare on Monday. Demonstrators were calling for salary hikes as the country tries to grapple with the pressures caused by a surge in coronavirus cases. The Nurses Union says that the country's economic crisis and inflation has seen nurses' wages plummet from about $800 in 2008 to around $35 today. Malawi's new president had a low-key inauguration on Monday after the ceremony was scaled back because of coronavirus. Lazarus Chakwera was sworn in at the country's military headquarters after he ordered that an event that had been due to be held at the National Stadium be cancelled. The inauguration was nevertheless a momentous one as Chakwera took office after winning a rerun of last year's annulled election, which had originally returned his predecessor, Peter Mutharika, to power. Now, millions of people in Ivory Coast have been plunged into poverty because of measures brought in to curb the spread of COVID-19. The economic blowback is hitting those in the least stable positions the hardest. Our correspondents report.
It has been more than 3 months since Valerie Kwasi lost her job. She previously worked as a housekeeper for an expat who suddenly left the country without warning. Unable to provide for her children, she left them with her grandparents.
They left because of the disease, because they need to eat. It's good that they are taken care of. I don't want them to go hungry.
Valerie was already struggling to make ends meet and is increasingly worried about being evicted from her modest home.
This pandemic really needs to end because it has made things hard for us. It's very difficult.
COVID-19 has claimed less than 100 lives in Ivory Coast, but the economic fallout has hit hundreds of thousands of Ivorians with brutal force.
I am here without a job. My husband is just about earning enough to survive with the children.
According to a study from the Ivorian National Statistics Institute and the United Nations Development Programme, around 7 million people, a quarter of the country's population, have been pushed below the poverty line because of the health crisis.
These low-income households with no savings have lost revenues and seen a fall in demand for their services. It is these households that have really suffered from the current situation, and the longer the health crisis lasts, the bigger the impact on these households will be.
In April, the government announced a response plan that would see financial assistance go to 200,000 vulnerable households and water and electricity bills covered for 300,000 others. For now, though, Valerie Kwasi, like many others hit hard by this crisis, is yet to receive any support from the authorities.
Well, that's it for Eye on Africa for now. Thanks for joining us. Do so again if you can. Take care.